Welcome to ACES Health Podcast, where we explore healing through the lens of anatomy, chemistry, energy, and soul. I'm your host, Dr. J.D. Young. Today, we are diving into a topic that often dismissed with a wave of the hand. It is just placebo effect. But what if the placebo isn't just anything? What if it holds a secret about how the human body heals and one we have been overlooking for too long? Let's start with something timely. Earlier this month, Robert Kennedy Jr., now serving as the Secretary of Health and Human Services, reignited debate in the medical world by proposing that all vaccines should undergo double-blinded, placebo-controlled trials, the gold standard for drug testing. No matter your stance on vaccines, the core idea is scientifically sound. To know if something works, we need to test it against nothing, or what we call a placebo. But that raises a fascinating question. If placebo do nothing, why do they often make people feel better? In trial after trial, patients who receive sugar pills, saline injections, or even sham surgeries often improve. They report less pain, better sleep, reduced anxiety, and even changes in the brain chemistry. It turns out body responds to context, the ritual of treatment, the care of a provider, the belief in healing. This isn't fake, it is measurable. Body scans show changes in pain centers, dopamine levels, rise in Parkinson's patients, and endorphins are released, all in response to placebo. Let's look at some powerful examples. In a Harvard study, patients with chronic low back pain were given placebo pills and told they were placebos. Still, 30% reported less pain, on par with over-the-counter drugs. In another study, Parkinson's patients injected with saline experienced a surge of dopamine and improved motor control just from expectation. And in a 22 landmark trial, patients with knee osteoarthritis underwent either a real arthroscopic surgery or a sham procedure, and both groups improved equally. These aren't flukes. They are windows into something deeper. Here's what's wild. You don't even need to believe in placebo for it to work. In open-label studies, patients are told this is a placebo. It contains no active medicine, but studies show it can still help. And guess what? It still helps. Why? Because the ritual, attention, and the meaning we associate with care are powerful. They tell the nervous system, you're safe, it's okay to heal now. At ACES Health, we don't dismiss the placebo. We recognize it as a sign of the body's natural intelligence, a healing signal that activates across all four dimensions. Anatomically, it reduces muscle tension, improves posture. Chemically, it helps hormone balance, lower inflammation. Energetically, it provides better mood, sleep, autonomic rhythm. At a spiritual level, it enhances the trust, hope, and purpose. Placebo isn't a fake healing, it's self-healing set in motion by care. So in my clinical practice, we want to communicate to our patients that we may never cure, often help, but we always care. So here's the truth. Healing doesn't only come from pills. It comes from being seen. It comes from storytelling, touch, environment, and meaning. So let's stop saying just placebo and start asking, how can we harness this power ethically, intentionally, and compassionately? Because when we do, we don't weaken science, we strengthen it with humanity. Thank you for joining me today. If this episode sparked new insights for you, share it with a friend or colleague, and subscribe to the ACES Health Podcast to explore how we can build a truly integrative, evidence-based, soul-honoring health system. This is Dr. J.D. Yang. Remind you, healing is not something we deliver, it's something we awaken.